This is Leanne Alanis, and this is my presentation for the axial skeleton. Starting with the cranial bones, this is the frontal, parietal, and occipital. The external occipital protuberance is where the muscles that keep the head upright and allow the head to tilt backwards attach. The temporal mandibular joint, the mastoid process, the styloid process, the external acoustic meatus, and the squamous part. Actually, right here. The internal view, the petrous part of the temporal bone, what structures are housed within this part of the temporal bone? The essential parts of the organ of hearing, the inner ear. The internal acoustic meatus, what passes through that would be the facial nerve. And the sphenoid, the external view of that would be the lateral greater wing. It's in here, the greater wing, and then the orbital. Inside is where part of the sphenoid would be attached. The superior orbital fissure, what passes through that would be the superior and inferior ophthalmic veins, the meningeal branch of the lacrimal artery, and anastomotic branch of middle meningeal artery, which anastomoses with a recurrent branch of lacrimal artery. The internal view would show the lesser wing and the greater wing. So again, the greater wing is right in here, and the lesser wing would be above that. The optic canal, which passes through this opening, the optic nerve and the ophthalmic artery with accompanying sympathetic nerve fibers into the orbital cavity. The sella turcica, the structure that sits on that is the pituitary gland. The ethmoid is in there. And the crista galli, what it does is it attaches to the ethmoid and is falx cerebri. This is a fold of fibrous tissue that works to separate the two areas of the brain known as the cerebral hemispheres. The cribriform plate, what passes through those holes are the olfactory nerve bundles. Now we're on to the sutures, and the coronal suture is right here, and the frontal and parietal bones are attached with that. The sagittal suture is here, and that's joining the parietal bones. The lambdoid, which is right here, that attaches the two parietal bones with the occipital bone. And then the squamous, which is right here, attaches the temporal and the parietal bones. Right here. Now to the facial bones. Faces out. The maxillary, the alveolar process, the nasal bones, the zygomatic, and the two bones that form the zygomatic arch are the temporal and the zygomatic ethmoid bone. Oh, the ethmoid, I'm sorry. The ethmoid is in here, inside in here, behind. Actually, it's in here. And the vomer, it's two bones that form the bony nasal septum. The bony part is the major part of the septum that consists of the perpendicular plate of the ethmoid and the vomer bone. The inferior nasal concha, it's right in here, these little tubes, and they regulate airflow and protect the inner nasal anatomy. The general function of the turbinates is to control airflow. And then the mandible. This is the mandible. This is the body. This is the angle. This is the ramus. This is the mandibular condyle, and the mandibular notch, and the coronoid process. Now on to the vertebral column. The four curves of the adult vertebral column are the cervical curvature, the thoracic curvature, the lumbar curvature, and the sacral curvature. And the two primary are the cervical and, the thoracic and the sacral. That's wrong. The cervical and the lumbar. The thoracic, nope, I'm going to go back. The cervical and the sacral are the secondary, and the primary are the thoracic and the lumbar. There are 7 cervical vertebrae, and the atlas articulates superiorly with the occipital condyles. And I'm able to do this as a result of that. And the unique thing about the transverse processes of all of the cervical vertebrae compared to those of the thoracic and the lumbar vertebrae is that it transmits the vertebral arteries and veins to the cranium. Now on to the thoracic vertebrae. There are 12 of those, and the spinous process is here. The transverse process is here. The intervertebrate foramen is inside, and the spinal column or the spinal cord passes through that. The body or the centrum is the larger part that's around in here, and the positioning of the vertebral discs are in between. The lumbar vertebrae has 5, and then the 5 right here. And then the sacrum has 5, and then the coccyx down here below. Now onto the sternum. This is the manubrium, the body, the xiphoid process, and the jugular notch. And then the ribs, 1 through 7, are known as the true ribs, and then 8 through 12 are known as the false ribs, and then inside in here are the floating ribs, these 2. And of the ribs, there is the head, the neck, the tubercle of the rib. And the way the rib articulates with the vertebrae is that the ribs articulate with the thoracic vertebrae, in particular the T1 through T10, as T11 and T12 don't articulate with the floating ribs of 11 and 12. T1 and T10 have a singular articulation with the head of the rib, connecting the costal facet on the vertebral body, and the tubercle of the rib connecting with the transverse facet of the transverse process. Thank you very much. That concludes my presentation.